Hi, I'm Jessie. I'm a doctor of physical therapy, and I'd like to talk today about concussion and post-concussion syndrome. In typical, standard, traditional Western medicine, there aren't many options for the treatment of concussion. There is emerging research and new work coming out that gives a little bit more hope and option for concussions that's different from the old standard of having someone go into a dark room and avoid being on the phone and watching television for a week. One exciting new approach to the treatment of head injury involves mobilization of the cranial sutures. So the cranial sutures are, in this model, wherever two colors meet. So there are cranial bones that in birth are separate, and as we age, it is believed that they fuse. Now, recent work and research has offered a different perspective in that some of these cranial sutures are still mobile even into old age. So through the Institute of Physical Art, I've had some training on how to go in through the mouth to mobilize the palate and some of the cranial sutures intraorally, which is just a fancy word for in the mouth, and also from outside of the skull through the skin. Okay, so that the philosophy behind mobilizing the cranial bones is that when there's a blow to the head, these bones can slightly shift, and even a small shift might make some sort of a change in the internal anatomy. The dura that encases the brain and the spinal cord can change, as well as the bones themselves. So when we assess the alignment of these bones and then mobilize them in an intelligent way to optimize alignment again, it enables the cerebrospinal fluid, which bathes the brain within the dura mater, around the spinal cord and brain, to move more efficiently and flow and do its job better, meaning helping to clear the brain of waste products, of byproducts of a head injury. So that's one exciting new option in the treatment of concussion. And I have to acknowledge the brilliant Dr. Charlie Simkovich of the Simkovich Cranial Institute in Pittsburgh, Pennsylvania. He's been doing work like this for over 20, 30 years and has treated thousands of patients with success in helping them get over their concussion and post-concussive symptoms. There's another modality that I'd like to mention that has promise in the treatment of concussion. Frequency-specific microcurrent is an electrotherapeutic modality like a TENS unit, but with far smaller amperage, so less current flowing, that can help with any painful condition associated with concussion. Clinically, I've seen really profound results in both the cranial mobilization and using frequency-specific microcurrent. Additionally, the benefit of working at a place like the Healing Collective, where we have an interdisciplinary team of brain specialists, we have doctors and nurse practitioners who can recommend supplements that help optimize brain function, as well as nutritional recommendations which do the same. So if you've been suffering from post-concussive syndrome, or if you've had a recent concussion, even if you've bonked your head on something and want to make sure things are optimally aligned, please, I hope you give us a call. We offer free 15-minute consultations where we can talk with you about how we might be able to help your symptoms. Thank you sincerely for your time, and I hope to hear from you soon. Be well.